Welcome. I'm Dr. Neville Wellington, Medical Director of the Nutrition Network. Sitting here in beautiful Cape Town. We have fantastic weather here and just recently off from the World Nutrition Summit. Thank you for joining us on this very important day, Breast Cancer Awareness Day. As you can see, myself and our guest Faranak are dressed in pink in honor of this day. And today we're privileged to have with us the Certified Nutrition Network Practitioner, Faranak Amini, MHP, terrain advocate for cancer, and founder of the Health Wealth Nutrition, who brings over 18 years of experience in clinical nutrition, metabolic health, low-carb, ketogenic space, and focus interest in cancer from a metabolic lens. So we're really looking forward to taking a deep dive today into a conversation that may challenge conventional thinking. What if we view breast cancer not only or primarily as a genetic disease, but as fundamentally a metabolic disease? What does that mean for prevention, treatment, and hope? To learn more about cancer as a metabolic disease, please sign up for our Nutrition Network Cancers training on our website, nutrition-network.org, and qualify for early access to Black Friday deals up to 70% off. And if you're a healthcare professional, a nutritionist, or a coach, you can actually become certified NNP or Nutrition Network Practitioner by doing our Nutrition Network's dedicated training and certification pathway. So for that, if you want to find out more, please email support@nutrition-network.org. Okay, well, now we've got the pleasantries out the way. I think let's get started. Faranak, thank you so much for joining us. I know you're a busy person, and we really appreciate all that you do. And
Thanks
we're
for
looking
having
forward,
me.
yeah, and we're looking forward to chatting with you.
Okay, thank you
Okay,
so much for having me on the call, and hello, everyone.
great. Okay, so Faranak, let's start with a bit of context. From your perspective in clinical practice here in South Africa, as well as your broader perspective globally, because you've been trained globally as well, do you have a picture of what the impact of breast cancer in our society is, and how's this trend been changing over time?
Sure. So I just looked at some statistics with regarding to the Cancer Association cancer in South Africa. So breast cancer is the most common cancer in women of all races, with
Wow.
a lifetime risk of 1 in 27 in South Africa, according to the 2023 National Cancer Registry. And breast cancer in South Africa have been identified as a national priority with increasing incidence every year. And approximately 19.4 million women aged 15 years and older live at risk of being diagnosed with breast cancer. And then globally, according to the World Health Organization, in 2022, breast cancer was the second most common cancer globally, and basically the most common cancer in women, with an estimated 2.3 million new cases and 670,000 deaths. And it is the most common cancer in women worldwide and the leading cause of cancer death among women in many countries. It mainly affects women, and approximately about 0.5 to 1% of breast cancers happen in men. The risk of breast cancer increase as women grow older, but many women under the age of 40 are also diagnosed with breast cancer. Literally, we're all at risk, and in particular, women with a family history of breast cancer, being overweight, inactive, getting exposed to the toxins, alcohol, poor dietary habits, and exposure to chemicals are particularly basically at a higher risk. So that's about basically the prevalence and impact. It's actually such an important thing to look at.
So like 1 in 27 women in South Africa at some stage may get cancer, which is approximately almost 5% of women.
And that's just the breast cancer.
That's just breast cancer. Sure, that's a high rate. So we're going to flip a little bit because we are going to look at this as a metabolic disease. You've trained in the metabolic approach to cancer, both with Nutrition Network and with the Metabolic Terrain Institute. Can you kind of give us a bit of an understanding as what is meant by viewing cancer as a metabolic disease rather than just a genetic disease?
Sure. Basically, the concept of viewing cancer as a metabolic disease rather than solely a genetic one is rooted in the understanding that cancer is primarily driven by metabolic dysfunction, particularly within the mitochondria, rather than just genetic mutation. So the metabolic theory of cancer suggests that the root cause of cancer is actually damaged mitochondria, which leads to altered energy production in cells where cancer cells are relying on fermentation or anaerobic respiration to produce energy, even in the presence of oxygen. And this is basically known as a Warburg effect. And this is in contrast to the traditional view that cancer is primarily caused by genetic mutations. So genetics and epigenetics do play a role in cancer development, while only 5 to 10% of cancers all are basically directly caused by genetic mutation. These mutations can influence mitochondrial function. So again, goes back into the mitochondria, and then basically epigenetics, which involves changes in gene expression without altering the DNA sequence, can be influenced by diet, lifestyle, environmental factors. And that means that while genetic predisposition exists, that's not our destiny. And then through epigenetic modifications, such as those influenced by diet and lifestyle, we can potentially alter gene expression and as well as mitochondrial function, which can impact cancer development and progression. So we can actually make a big impact through nutrition and lifestyle modification, both with managing cancer and doing other things on the side beside the conventional treatment, as well as we can possibly go a step further and actually prevent it by looking at the risk factors.
Yeah, I think we're going to definitely talk more about how and what, but just a question. I mean, it sounds like we've got a bit of genetics, but then the environmental impact seems to come in and can make it worse. What is the evidence, or what evidence leads you to believe that cancer is metabolic rather than genetic, in a sense? I mean, have you got some studies that you can, or some evidence show us or tell us?
Yes, sure. Yes. So the evidence basically supporting the view that cancer may be more of a metabolic disease rather than solely caused by genetic mutation includes kind of several key observations and studies. One is basically mitochondrial dysfunction. Research has shown that cancer cells often have damaged mitochondria, which are the energy basically producing structures within the cell. And this damage leads to altered energy metabolism, where cancer cells rely on fermentation to produce energy, even in the presence of oxygen. So this is basically known as a Warburg effect. And this is how we can, through a metabolic lens, basically block the energy pathway of cancer and put the cancer cells into the state of metabolic stress. The Warburg effect has been around for a very long time. Then there was studies about cell nucleus transfer studies, which kind of experiments have demonstrated that when the nucleus of the cancer cells is transferred to a normal cell with healthy mitochondria, the resulting cells does not become cancerous. And then conversely, when the nucleus of a normal cell is placed into a cell with dysfunctional mitochondria, the cell can exhibit cancer behavior. And this suggests that mitochondrial health plays a crucial role in cancer development. Dr. Thomas Seyfried did a lot of studies on that. And basically, cancer cells have a unique way of metabolizing nutrients. They consume glucose at a much higher rate than normal cells and are less efficient in using oxygen for energy production. And basically, this is one of the hallmark of cancer, the altered fuel utilization, which can support the idea of that cancer is fundamentally a metabolic disease. And also high level of insulin and insulin growth factors are also associated with increased cancer risk as well as progression, where these hormones promote cell growth and proliferation, and their signaling pathways are often upregulated in cancer cells. And this connection between metabolic hormones and cancer further supports that metabolic theory of the cancer. And also, there are some epidemiological studies that have shown that diet and lifestyle significantly influence cancer risk. High sugar intake specifically is very important in increasing your risk of cancer. Obesity, very specifically, excess body fat, sedentary lifestyle linked to increased cancer incidence. And this basically all suggests that metabolic health is a critical factor in cancer development. And these pieces of evidence basically point toward the importance of metabolic processes in cancer, highlighting the potential for metabolic interventions such as dietary changes and lifestyle modification to actually play a role in cancer prevention and treatment. It's basically what else you can do on the side to make your treatment a lot more effective and kind of make your internal environment of the body, which is called your metabolic train, inhospitable to cancer. So there is a lot more to look at besides just the genetic.
Sure, fantastic. Thank you. That's quite an intense explanation. It's wonderful. Thank you. So if we think about breast cancer for a moment, and we often talk about hormone sensitivity. So patients will have their hormones checked or the cancer cells checked for estrogen receptors and other hormones. Can you speak about the role of hormones in this context, but also how metabolic lens integrates with that hormonal influence?
Yes. So so a lot of the breast cancers are actually hormone positive. So they call it estrogen positive progesterone, as well as HER2, which is basically a protein. So the patterns we'll be basically looking at include any form of hormonal history. So where we have this, when we talk about breast cancer, very specifically estrogen positive, we kind of go back and look at the history. So we're looking at kind of patterns including any form of hormonal history, whether it was kind of steroids to treat for asthma or topically creams to treat a skin rash. We look at birth control pills, if you've been using birth control keys, IUDs, bioidentical or synthetic hormones, or things labeled as herbal or natural hormones. We basically look at the history of all of that, if the person has been using those or not. And basically, we're also looking at estrogen mimicking chemicals, which are the artificial hormones that have a different chemical structure, but behave the same as estrogen in our bodies. So both type of estrogens can be found in many products that we use on a daily basis, such as birth control pills, which kind of contain synthetic estrogen. Estrogen mimics are found in herbicides, in parabens, in many personal hygiene products. You can see them in plastics. You can see them in chemicals, in non-stick cookware, pots and pans, in detergents, household cleaning products, in shampoos, conditioners, literally everything that we use on a daily basis. They have estrogen mimicking chemicals, which can kind of change the hormonal balance in the body and drive estrogen positive hormones. So these estrogens basically enter also the water through human and animal excretions that are rinsed down the drain and basically deposit directly into the groundwater. And wastewater treatment facilities do not have the technology to remove that estrogen, or estrogen mimics from wastewater. So a level of estrogen continues to rise as they cycle through our waterways. So eventually you actually get estrogen from the water that you use. So it's, again, very important to use filters. And basically, humans and animals are exposed to potentially dangerous estrogen concentrations. And overexposure to estrogen has been correlated with increased rate of breast cancer, as well as uterine gynecological cancer, prostate cancer, as well as basically it can reduce sperm count and sex drive. So it is very, very important when we look at estrogen positive hormones, because one of the treatments offered by the conventional treatment is basically they do estrogen blockers. What that does is basically it kind of blocks estrogen, but I mean, if you're still receiving estrogen from your environment, again, you are not addressing the root cause. So we need to look at the environmental toxins and the impact it has basically on our bodies. And you can actually go further down, even before you get cancer, you can see sign of estrogen dominance in your body. So which can be anything from, extreme fatigue and brain fog to mood swing to irritability, depression. Excess estrogen can also show up as weight gain around the hips and thighs, especially after menopause. It can be, the sign can be heavy menstrual bleeding, excessive cramping before or during your monthly cycle. It can cause basically estrogen-related cancers as well as fertility issues. And there are really some easy things that you can do, which can reduce your exposure. So this is important for anybody who is currently dealing with cancer, estrogen positive cancers, or if you want to actually reduce your risk of getting there. So basically, whenever we are thinking about cancers that might have this sort of hormonal driven pieces, we also need to think about body fat content. So you want to make sure that you are getting body fat, not necessarily BMI, but the body fat percentage content below at least 25%, because the more fat you have, the more estrogen you also kind of have in your body. And then from the basically toxicity perspective, I mean, really easy things. For example, do not use herbicides on your garden, on your lawn. Use personal hygiene products that are labeled paraben-free. Try and switch over to more of, organic, natural, green products, just to stay away from chemicals. Detox your kitchen, get rid of the plastic, get rid of the non-stick pots and pans, use the stainless steel water bottles and, instead of plastic bottles. So there is no kind of benefit of having a water filter in the house but then drink it from a plastic bottle. So use glass or steel to also store food in the fridge. Do not use non-stick cookware. Stay away from also soya, corn, gluten, and legumes. They have a very high content of glyphosate, which is a pesticide which basically used on all these grains and legumes. So for anybody who's dealing with cancer, that is a big issue. And then also try and pay attention to the skincare products. The two chemicals that you need to look at is parabens and benzophenone. So those are kind of important chemicals to look out for. Try and also avoid foods. So when you think about cancer, it's actually all like metabolic health, generally speaking. It's not just about what you eat, it's also what your food eats. So you kind of need to go a little bit further, a step further, and avoid basically processed food, preservatives, additives, food coloring, flavoring, and try and eat food as close to the nature as possible. So if nature didn't make it, don't take it. Avoid insecticides and basically look at, beauty products and all of that to kind of try and avoid chemicals which can affect the amount of estrogen you have in your body. So those are really, really important things to address regarding very specifically the estrogen positive cancers. The environmental toxins have a very, very high impact in that perspective.
Sure. So I mean, it's that's a really broad sweep of things. I mean, that would take quite a lot of changes in one's kitchen and in one's life, because we're also used to these things, and we almost can't believe that they could be as effective or have high estrogen and affect us so badly. But that's great.
Exactly.
Yeah.
So it's sometimes you think like no, I'm not exposed to toxins, but it's not a question of if you're getting exposure or not. It's how much of it you get exposed to on a daily basis, and how your body can actually kind of eliminate those toxins. So how to support your body's detoxification pathways to actually get rid of those toxins. So that's very, very important.
So let's just talk a little bit more, from going further into the sort of metabolic side. We've spoken quite a lot about the hormone side. How does being overweight, you mentioned overweight increases estrogen because of the fat metabolism to increase estrogen levels.
Yes.
So insulin resistance, so all that kind of falls into where you are, where it's helping to drive or increase the risk of the hormones. Am I correct?
Yes.
So how might lifestyle and diet and metabolic health influence hormone-driven cancer risk? I think you've partially answered that, but maybe just give us a recap on how that specifically your poor lifestyle and probably high sugar lifestyle drives that risk.
Yeah, it's basically, it's kind of like a metabolic dysfunction, which kind of, includes insulin resistance, obesity, dyslipidemia, chronic inflammation, which is a common kind of background or risk context for breast cancer and also at the top of cancer. And they kind of, for example, if you look at the insulin resistance, this condition basically happens when cells in the body become less responsive to insulin. So that leads to higher levels of insulin in the blood, and insulin is a growth promoting hormone. And so elevated levels can stimulate the proliferation of cancer cells and inhibit apoptosis. So apoptosis is basically programmed cell death, where your body detects abnormal cells and gets rid of them. So if you are in a state of insulin resistance, high insulin levels can affect that progress. So it can increase your risk of cancer. From the obesity perspective, very specifically, excess body fat is associated with increased production of estrogen that can promote growth of certain types of cancer, including breast cancer. It also contributes to the state of chronic inflammation, as well as insulin resistance, which can then link to cancer development. Dyslipidemia is also where you have basically abnormal levels of lipids in your blood. For example, high triglyceride levels, low LDL, low HDL cholesterol, and then this is often also associated with metabolic dysfunction, extra visceral fat, insulin resistance, which can then contribute to pro-inflammatory environment, which is basically the right environment for cancer progression. And then the chronic inflammation by itself can lead to DNA damage, promote the growth and spread of cancer cells, and basically all of these together can create an environment which can help, tumor to develop and progress. So the metabolic dysfunctions are interconnected, and often coexist with each other. So creating an environment that supports cancer and progression when all of these exist together, and addressing these metabolic issues through lifestyle interventions such as diet and exercise, and can potentially reduce cancer risk and improve outcomes for those who have cancer. So most cancers actually start way before we see the symptoms. So cancer is not a virus that you get overnight. It's a process that is happening for you in your body for a long period of time. And by the time that it gets to the detectable size where they tell you have cancer now, that process has been going in your body at least for about 10 to 15 years. So most cancers actually start by the age of 20. And as the body ages, toxic exposure, increase and genetic damage occurs because of all of that. Depending on inflammation and the overall condition of the person's terrain, that deterioration may basically eventually result in a life-altering or life-threatening cancer, perhaps many years or decades later. So this is a good reminder of how important it is to pay attention to what kids are eating, the toxins they put in their skin, into their bodies, medication they've been given, because it's basically a metabolic dysfunction which can create the right environment for cancer to thrive. So within the metabolic approach, we mainly focus on making your body inhospitable to cancer. So what you can do to make your body strong so that cancer cannot thrive in it. So
Okay.
that was just a link.
What you're saying there is how do we actually change that whole metabolic environment? What do you actually do practically? So, I mean, we've now kind of almost done the theory of what happens, but it's now, I think I'd like to chat a little bit more. What does actually metabolic therapy look like to a patient that you've seen? And I mean, have you had patients who've reversed, healed their cancer with metabolic therapies, or at least done better? What and then how would you lead them to get there?
Yeah, so what we do basically with the metabolic approach is that, so now the whole kind of context, or the way that we look at cancer. So if you look at the conventional treatment and the way that look at the tumor, so we look at cancer as a tumor, and then we basically want to get rid of the tumor. So it's like cutting a tree from a surface, but if the roots are there, we are not addressing the root cause. So what the metabolic approach does is that we look at the internal environment of the body, which we call it a biological train or metabolic train. And there are different factors within your metabolic train which need to be in balance and harmony together. So we basically look at 10 factors, and this is what, this whole metabolic approach is what, I've been trained with Dr. Necia Winters, which is very, a recognized face globally. So we look at the 10 different factors, which includes your basically genetics, epigenetics, it's your immune function, your hormonal balance, your basically blood sugar and insulin, which goes back into nutrition. We look at inflammation, blood circulation. We look at stress and trauma, We look at, your sleep. We look at mitochondrial function, and we basically look at the health of your gut microbiome as well. And there is a way that we assess your to see where is out of balance. We call it a Train 10 questionnaire, or a Train 10 test, where we ask a lot of questions which goes right through your background since the time that you were born, and all of that, and what you got exposed to, which then gives us a score. And according to that score, we can see which areas in your body is mainly out of balance and what we need to focus on the most. And we basically start focusing all of those areas by one. And then from my experience so far, I think like the kind of main 3 points that really need to be focused on is, first is obviously your blood sugar and insulin, which kind of goes back into diet. And it has been proved that, cancer cells feed off sugar. Just kind of to put it into context for, anybody who thinks, it's difficult to understand, is that to detect cancer, they tell you to do a PET scan. When you do a PET scan, in preparation for the PET scan, they ask you to come fasted, and then they give you an injection of radioactive sugar. So that radioactive sugar kind of circulates in your body, and basically that is what is lighting up the scan. And the areas which have the highest sugar consumption, those are the areas which kind of show up on your scan, which they tell you, you have cancer in this site and that site. So the more dense those areas appear on the scan, the more aggressive the cancer is. So we kind of detect cancer from its rate of sugar consumption. So it really does make sense that cancer, feeds off sugar, or its kind of main fuel source. So that's one thing which is really, really important. And, talking about breast cancer and, estrogen positive and all of that, a lot of the conventional treatment therapies also, kind of push that pathway in the wrong direction. They actually increase, blood sugar and insulin and all of that. So it even makes it a lot more important to look at the diet if you are going through any of the conventional treatments, because they do increase your blood sugar and insulin, some of them. So it's very, very important to look at that. Another factor which is very important is environmental factors, which we did touch on it very quickly. We don't have time to go into a lot more details. And then the role of, stress and trauma. I think that is something that we don't really take so much, we don't think about it that much. So the stress, post-traumatic event, adverse childhood experiences, those are the things which can really, trigger something when your body is out of balance. So those are kind of the most important part. But again, everybody is a little bit individualized. So in the practice, we basically look at what needs the most attention, and we try and start from there. For me, because sort of my background is mainly in nutrition, immediately the first thing we start is with the nutrition, because that can literally is kind of, I think it's the most effective one, and it can address all hallmark of cancer. So it can reduce inflammation, it can basically reduce toxic burden within the food system. It can help, it can basically put cancer cells in the state of metabolic stress, because we limit the sugar and carbs. So I'm mainly talking about low-carb ketogenic diet in the term of cancer. We use intermittent fasting protocols and all of that, but it really depends on what we're dealing with. So it's not a protocol, it's very, very individualized on what we are dealing with, what the person is, what their background is, what their current dietary habit is, what their body composition look like, what type of cancer they have, where they are within their journey, what is their support system look like. Is this person underweight, overweight? Is there room to lose weight? What treatments are they going through? And basically looking at intermittent fasting, it might not be the right thing to do for certain people. So we kind of look at all of that and make it very, very individualized from the nutrition perspective. We also look at, certain tools which we can use sort of to track the progress, tracking the food, tracking blood sugar, ketone levels, and all of that. So we don't have time to go through a lot of that in more details, but basically, I mainly focus on nutrition to start with, and once they got the basics right, we go into kind of nitty-gritty part of it, and then also on the side, we look at the toxic burden, we look at trying to manage stress, what can you do to reduce your stress, we look at the support system, and we kind of try and work around that. And yeah, so that's how kind of I start mainly with the clients. It is really, really personalized. We do a lot of testing. We look at look at certain labs. For example, in the case of breast cancer, it is very important to look at blood sugar, insulin, HbA1c, because it is highly metabolic. We look at vitamin D. It's kind of very, very important. We look at the whole metabolic panel. We look at blood counts. We look at inflammation markers. We look at LDH, sedimation rate, and kind of all of that. So there's a whole lot of labs that we look at on a monthly basis, and this is something that I think our normal, conventional treatment is not doing, because the lab testing is not that comprehensive as we want it to be. So that can also guide us through nutrition. If you need to adjust protein, for example, can the person have dairy or not? So we look at lots of blood markers also to kind of come up or get clues about, nutritional status of the person. Another tool that I use in my practice, nutrigenomics, that's very, very important, basically to make sure, how the person can handle a specific type of food with specific type of fat, what are the risk factors, and what you can do from the nutrition and lifestyle perspective to kind of enhance, for example, a person's, or your body's detoxification pathways, for example, to get through the toxins. I really like to use actually the nutrigenomic testing as a prevention, because we kind of wait to get the problem and then think about how can we solve the problem. But I think it is actually very important to use it as a preventative tool, because you can see that genetically what your predispositions are and what you can do from the nutrition and lifestyle perspective not to get there. Because I think, to be honest, the best defense against cancer is try and not get there. So it's actually good if you can look and see what you are predisposed to and what you can do, and try and make changes now while you have time, while you are not in that shock, but while you don't have that stress of going through the whole cancering journey. But even if you are going through that, nutrigenomic testing is one of the basically tools that I also use in my practice, which is kind of quite valuable to help with with that specific person, or to individualize to the
you're basically talking firstly about getting the background terrain correct and as best as possible, so that you can then work with all the other avenues that you've got, all the other tools, trying to get the inflammation down, etc.
together.
So can I ask, now you're seeing a patient. Have you got a few stories, maybe a story of a patient who's been able to take this journey, that does a lot of this, and has had some success? How do you as a coach work with the patient? And do you work with some of the doctors that do they refer to you as well?
Yeah, so I think that is a tricky part, working with the doctors. That's always very challenging, very specifically if you kind of want to work with an oncologist, because they usually train in a different way as us. But I am fortunate enough that I have a few doctors that we work together, which kind of which do take this whole metabolic approach into consideration. And if there are any doctors who are listening to this talk, I just want to say that when we talk about the metabolic approach, we are not ignoring the conventional treatment by any means. So what we are talking about is what else you can do on the side to make even your treatment a lot more effective. Because what happens is that, if you basically looking at nutrition, when you eliminate the sugar and carb, you put the, cancerous cells in the state of metabolic stress, and any other treatments that you kind of do at that same time has a much higher kind of impact. or it can also reduce the side effect while people are going through treatment. So kind of to give you an example, yes, I do have people who are dealing with cancer and we work with, and they do have kind of quite a good outcome. I mean, I had one of my patients who had, I mean, still dealing with it, stage 4 men's breast cancers, which is kind of very rare. And he had to go through all the chemo and all of that. And I never give anybody any kind of insight on do the conventional treatment or not. I think that is a personal decision between you and your doctor. I just tell you what you can do on the side, which can help your treatment, because I'm not a medical doctor to give any advice on that perspective. But he was going through quite an intensive, chemo treatment. And then, we did look at nutrition right from the beginning. We implemented some fasting protocols, before chemo days. And he really didn't get any side effects of the chemo. Like you usually see people are saying that, they feel nauseous, they can't eat, they're vomiting, they have very low energy levels and all of that. So he actually didn't have any of those side effects. So he kind of tolerated it pretty well. But we did have a lot of challenges with the conventional treatment of, forcing him to eat. And, the nurse get angry because she said I'm fasting. So yeah, there are those things. So we decided actually to say, okay, you don't say anything that I'm fasting, just keep it quiet and say I don't want anything. So there are challenges like that. He then also had to go through some radiation because he had metastasis to the brain, and they were actually radiating the whole brain. So expected to get extreme side effects, and it wasn't targeted, they were radiating the whole brain. So we were expected lots of side effect from the radiation. And again, we did longer fast before, after radiation, specifically where the radiation was on a Monday, so we had the weekend to do a long fast. We did use, we kind of do measure blood ketones and glucose levels, so we tried to be in a therapeutic level of ketosis. And again, he did tolerate it quite well. The doctor was very surprised of him, tolerating it very well, didn't feel, extreme fatigue and all of that. And then the brain tumor completely disappeared after that. The stage 4 breast cancer still in the progress, so reducing the cancer markers are back to the normal, but the scan is not clear yet. So yeah, I mean, I do have quite a nice success stories. I wouldn't say remission. I don't know what's, you always have that thing of, the cancer might come back. And at the moment, the reoccurrence rate is very high. But I think, again, addressing all those lifestyle factors can also reduce your risk of reoccurrence, because when you look at, if you're not addressing the root cause, so you can never heal from the environment that made you sick in the first place. So if you don't change the internal environment of your body, the cancer can come back again. It's like a garden. When the soil is not healthy, everything can grow in that soil. When you make the soil healthy, you have healthier plants. So the same happens in your body. So however, it's a bit challenging. So we can't help everybody. So, the person needs to be ready to implement all these changes, and it's difficult and it is challenging, but it is doable.
Yeah. So, I mean, somebody who's actually undergoing conventional treatment, I mean, we see a lot of that. Just going back, I mean, we obviously see patients who go through, surgery, chemotherapy, radiation, hormone therapy, and so they could be at any one of those stages along the way. What would you advise to a patient who's busy going through those stages in terms of adding metabolic therapies if they're interested? Because some people might actually start becoming interested in this now, even after what we've been speaking about. Would you just say get on with it, start fasting, cutting out sugars, or come and see you and spend some time? Or what hope do you give them?
Yeah. So I would say, education is quite important. So try and, go through different resources, valid resources, because you can also get quite a lot of misinformation, very specifically from, different communities, Facebook groups, all of that. So make sure that the information you get is good information, and then have kind of open communication. If you're interested, you kind of discuss your interest in metabolic therapies. You can discuss it with your oncologist. So you need to have their support. So find the right doctor to work with. And then also, you need to work with a specialist, because you kind of just need to do it correctly. Fasting is good, but it's not recommended for everyone. So if you're a person who shouldn't be fasting and fasting, then you're kind of not going to get benefits from that. So it's very important to have the team of people who can help you. So I would say ask for help if you are interested in that, and then do your research, work with a specialist. Consider working with somebody who is an integrative oncology specialist, or nutritionist, which is kind of experienced in metabolic therapies. Dietary adjustment, I would say, if you want to start on your own, the first thing to do, cut out sugar and processed foods. And then just bear in mind, sugar is not just sugar. Carbohydrates are made out of sugar. So that's something that you can start on your own. Eliminate processed foods, and kind of try and bring that metabolic flexibility back. Try and manage stress. I know it is difficult when you kind of in that stage of life. And ask for help. If you need help, get that help and start working on it. It is very, very important. It's probably, it does help you with getting much better outcome from your conventional treatment. So I would say don't wait, because it's important. If you are going through chemo radiation, it makes your treatment a lot more effective when you address everything else on the side. So that's kind of my advice for somebody who is going through the treatment right now.
I mean, as a GP myself, I've had some interesting cases, and I remember one lady a few years ago really opened my eyes to this. It was long before I was even aware of the metabolic theory of cancer, and she did the whole fasting, chemo fasting, and went through it really well. And in fact, her oncologist again was incredibly impressed with not very few side effects, and she healed very well. So that and so that really piqued my interest in what's going on, and then having some of my own personal journeys, not personally but family journeys through this. So I mean, what is your message of hope to someone who's just been diagnosed with breast cancer? Let's just say, how can we actually give them hope in this space, because it is terrifying to have a cancer diagnosis, and I think people get into this very quickly, and it seems so overwhelming.
So it is a challenging and life-altering experience, I would say. But remember that you are not alone in this journey. So there's a vast network of support available to you, from healthcare professionals to support groups and loved ones who are ready to stand by your side. And then, within that challenging environment, try and stay positive. So embrace the opportunity to actually start learning about your body and your health, and take an active role in making informed decisions about your treatment. So sometimes, healing is not just about adding more, because we're always looking for, what can I use? What pill can I add? What treatment can I add? It is sometimes about actually removing what is harming you. And that's would be, if you look at your, what is harming you, I mean, just generally speaking, it's sugar, stress, toxins, noise, comparison. So again, you cannot heal in the same environment that made you sick. So embrace that time to learn about your body, listen to your body, and implement those changes which can help you have a much better outcome.
Fantastic. So Faranak, lastly, people want to get hold of you. I mean, you're a fantastic coach, and I can really recommend Faranak. She's got a wealth of experience. She's given you so much of herself in this conversation, and she is helping patients. She's helping coach patients through these journeys. How can they get hold of you?
Sure. I mean, you can get hold of me. I can basically give you my email address. My website is healthwealth.co.za. Yeah, I don't know if I should kind of type it out, but yeah, my email address is Faranak, FARANAK @health-wealth.co.za. You can find me on Facebook. You can basically reach out through my website. Phone number that you can call, it's 082-999-5786. So that is also a phone number that you can reach out. And yeah, I mean, I'm happy to help and support you if you just want to have a talk and, discover, what your next kind of step is. Happy to do that. I do always, send lots of resources before people commit to this, because to be honest with you, if you are thinking about this approach, you kind of need to be adaptable and willing to change. So it is very important to be open to holistic and integrative methods and willing to make significant lifestyle changing, and to be committed to, ongoing monitoring and active participation in your health journey, and kind of be adaptable to change. But yeah, I would be more than happy to help or answer your questions if anybody has.
Fantastic. Faranak, thank you so much for sharing of yourself. Obviously, we really recommend that patients, this is not taking over conventional treatment. This is not to say don't do conventional treatment. This is just to say there is other ways you can help your cancer journey. So fantastic. And thank you for the time. Honestly, it's been such a pleasure. And we hope that that's really been helpful. And we really hope and pray for everyone who has cancer and is going through a hectic journey, and that you will really take it to another level and help yourself and heal yourself. Thank you.
Thank you so much.